Title: Distinguishing Alzheimer's from Dementia, a Comprehensive Exploration. While Alzheimer's and dementia are often used interchangeably, they represent distinct conditions. Dementia is a broad term describing an individual's cognitive challenges, affecting their ability to think, remember, and make decisions, thereby impacting daily tasks. Although more common in older adults, dementia is not a normal part of aging. Alzheimer's disease, the most prevalent form of dementia, specifically involves memory loss and difficulties recalling information, even with assistance. Early onset versus late onset Alzheimer's. The majority of Alzheimer's cases are late onset, occurring in individuals aged 65 and older. However, around 5% of cases manifest as early onset Alzheimer's, affecting individuals in their 40s and 50s. Early onset Alzheimer's is often more severe than its late onset counterpart and may take longer to diagnose. Symptoms extend beyond memory loss, encompassing attention or planning challenges, speech difficulties, and vision changes. Symptoms across Alzheimer's stages. Alzheimer's symptoms vary based on disease severity, with a gradual onset unlike other brain problems. Early-stage symptoms may go unnoticed by many but become apparent to those close to the individual. These may include forgetting appointments, mixing up events, misplacing items, struggling with bills, and difficulty with familiar tasks. Seeking guidance from a healthcare provider is crucial if Alzheimer's symptoms are suspected, as early detection can be challenging due to the gradual progression of the disease. Moderate Alzheimer's. In the moderate stage, symptoms become more pronounced. Individuals may experience confusion about the year, location, and personal information. Personality changes, agitation, depression, and delusions may also manifest. Severe Alzheimer's. In the later stages, severe impairment in memory and cognition occurs. Communication becomes challenging, responses to the environment diminish, and controlling movement becomes difficult. These individuals require continuous monitoring and care. Prognosis and complications. The life expectancy after an Alzheimer's diagnosis varies but typically ranges from 4 to 8 years. Disease progression differs among individuals, influenced by responses to therapy and other health conditions. Complications may arise, including incontinence, an increased risk of respiratory illnesses, dehydration, dental problems, and falls. Causes and risk factors. The precise cause of Alzheimer's is unknown, but brain changes, including abnormal strands and clumps of specific peptides, are implicated. Multiple factors, rather than a single cause, contribute to the disease. Age is a significant risk factor, and other contributors include heart disease, poorly controlled diabetes, traumatic brain injury, malnutrition, exposure to toxins, and smoking. Genetics and Alzheimer's. Genes and environment play roles in Alzheimer's risk. A family history increases the likelihood of developing the disease. The apolipoprotein E, APOE, gene is a significant genetic factor, with a specific variation occurring more frequently in those with Alzheimer's. However, not everyone with this gene variant develops the disease, except in the case of early-onset Alzheimer's. Down syndrome and Alzheimer's risk. Individuals with Down syndrome have a heightened risk of developing Alzheimer's, potentially linked to an extra copy of genes on the 21st chromosome. Confirming an Alzheimer's diagnosis. Diagnosing Alzheimer's involves a thorough assessment, including a medical history review, cognitive tests, blood tests, and imaging techniques. While no singular test exists, recent advancements include testing cerebral spinal fluid for specific markers. Alzheimer's treatment. Effective Alzheimer's treatment involves a multidisciplinary approach, combining non-pharmacological interventions and medications. Memory aids, consistent routines, and addressing other medical conditions are essential. FDA-approved medications like cholinesterase inhibitors and memantine may alleviate symptoms, but they don't address the disease's underlying causes. Controversial biologic therapies like Aduhelm and Leqembi, targeting the disease's root cause, have been approved. Living with Alzheimer's disease. Individuals with Alzheimer's require comprehensive support as the disease progresses. Support for family and caregivers is crucial, with awareness of the potential for caregiving burnout. Various organizations, including the Alzheimer's Association and Alzheimer's Foundation of America, provide resources and assistance. Alzheimer's awareness. June marks Alzheimer's and Brain Awareness Month, emphasizing the importance of raising awareness and funds for research. November is Alzheimer's Awareness Month, with activities such as wearing teal to raise awareness. Conclusion. Alzheimer's is a complex, progressive brain disorder, the most common form of dementia. Understanding its distinctions, symptoms, causes, and available treatments is vital for individuals, caregivers, and healthcare providers. Early detection and intervention can significantly impact the quality of life for those affected by Alzheimer's. Open communication with healthcare providers and support systems play crucial roles in navigating the challenges posed by Alzheimer's.